Ryan. I'll be your pharmacist today. Today we'll be going over some things like your insurance and some basics of it, just to make sure that you get the gist and you get what's going on with it, as well as talking about some of your medications and why you're paying certain amounts for them, basically so we get on the same page so you can understand why you're paying for certain things and have a little bit more clarity towards your insurance. So before we start, would you mind confirming your name and your date of birth?
Yeah, my name is Sohil Kapadia. My date of birth is 7/8/98.
Alright, so Sohil, before we start, I just want you to know that insurance is one of the more difficult things to grasp. It is not a very great concept. We're going to be going through the basics of it, and I'll give you some concrete answers to what certain things are, why you're paying for certain things, why prices fluctuate, and things like that. So first off, do you have any information about health insurance at all?
No, I don't know anything about it.
Alright, so basically I think the easiest place to start is probably premiums. So what a premium is you're going to have to pay this every single month. Every insurance will charge a different premium, and every month you will have to pay the same price for your coverage. So when you go and say you get this certain insurance that charges a $20 premium a month, you will pay $20 at the beginning of the month for the whole year. And then when you get a new plan, it'll have a new premium. But that is something you always have to pay, no matter if you use the services or not. It's something you always have to pay, or else you will not be getting services. So does that make sense, what a premium is and why you pay it every month?
Yeah, so premium is something I have to pay every month, and the price will be fixed until I change plans.
Yeah, so the price will stay the same. Good. So next we'll move to deductible, which is a little bit more confusing. So basically, the way a deductible works is it's a flat rate price that a insurance company will set, and it basically acts as a threshold that you have to hit before your coverage starts. So say your insurance has a $500 deductible. That would mean that you will have to pay for services out of pocket up until you reach $500 worth of paid for, and once you get to that point, then they will start to pay for it. And when they start to pay for it, what it's called is a copayment. The copayment is another set price. So insurances will set that, after you reach your deductible, you're going to start paying a $5 copay on all your generic medications. So what that means is you have to pay cash price for all those medications. Once you reach $500, then you'll start getting that $5 for all of your copays. Once the term resets though, that's when the deductible resets. So usually, if your insurance has a full year term, then you would go for a full year with only paying the deductible once. Does that make sense to you?
Yep.
Alright, and you understand how a deductible will go and then it'll turn into a copay eventually once you reach a certain point in your insurance?
Yeah, so deductible is a certain amount of money that'll be paid for, and once I hit that amount, I have to pay the copay every time I go to see my doctor.
Exactly.
Okay. So I have one question.
Yeah.
How do I know how much of a copay I pay for different drugs? Is it like a fixed price the entire time?
It's an awesome question, Sohil. So basically, there is a formulary that the insurance will have, and this formulary is basically a big list of all the medications that this certain insurance plan will cover. And it'll just be a big list, and it'll usually have more common drugs to the most common medical disorders or problems like that. So you'll have a lot of different drugs on the list, basically trying to be able to get the best of everything so everybody can work with any insurance, trying to make it most convenient for people to get them to choose theirs. And basically this formulary list, they will break it down into tiers and use a tiering system. This tiering system breaks them up by certain different categories. It depends on the insurance, but typically insurance will break it up by things like whether the medication is generic or brand, whether it is preferred or non-preferred, commonly prescribed or not, and they'll break it down into tiers. So say for instance, the most typical thing you'll see is a low tier, so a tier 1 will typically be generic drugs, and for those drugs you'll always have to pay less than a $5 copay for. As you start to move up towards tier 2, you'll start to go towards, let's say, brand drugs, which will have a higher copay, and then you can move up to specialty drugs, which will have a very, very high price. So tiering is basically a way that the insurance company splits up all the drugs on the formulary to let you know how much you can be expecting to pay for your medications.
So how do I know which coverage and formulary list is like best for me and my prescriptions?
So that's when something called star rating comes in. basically what the star rating is it takes everything into account. It'll take deductible, copay, premium, all of the tiering and formulary, what drugs it has, what it doesn't offer, and it'll combine them all to give it an overall score of what is the best. So you can look at things and look at certain reviews that'll also factor into this star rating to help you really pick what is the best insurance for you personally.
Okay, that's helpful. Thank you.
All right, and I looked into your profile and I saw that you'd been taking Crestor. Is that correct?
Yes, I've been on Crestor for almost a year now.
All right, and were you aware that Crestor was a brand medication?
I've heard of brand medication before, but I did not know Crestor was a brand medication.
Yes, so basically Crestor is a brand medication, and rosuvastatin calcium would be the generic version of the medication. So they can be dispensed as either way. Typically people will get the generic and they'll be prescribed the generic because it's much cheaper. The drugs are the same exact thing pretty much. They have very similar chemical properties. They have the same pharmaceutical ingredients that intend to give you effect in your body. The only thing that they really differ in is things like color or maybe inactive ingredients that won't give you any pharmaceutical effect or any problems, any side effects. So basically, it's the same medication, just a cheaper version of it. And the reason why it's cheaper is because the brand manufacturer first had to make this medication, so they had to go through a whole process of tests and labs and things like that. The generics don't have to do that because all the work's been done. They're just recreating that work and making a cheaper drug. And many manufacturers will make all these drugs and a bunch of different generic options. That way prices get very competitive with them. And as it gets more competitive, that's why the generic prices come much lower. And it's usually more affordable to get the generic medication as opposed to paying more money for the brand.
So basically for a year now, I've been paying more money for like a medication that could have gotten cheaper?
Yes. So your doctor should have let you know that you'd been getting Crestor, when in reality you could have been getting atorvastatin. It should exert the same effects, and you shouldn't notice much difference. However, some people do believe that brand medications do work better for them. So that could be in the case for you that your doctor does not think that atorvastatin calcium would be good alternative therapy, but realistically speaking, it is the exact same medication and it should exert the exact same effects.
Well, I'm interested and excited to talk to my doctor about possibly getting rosuvastatin calcium instead of Crestor, and then I can save some money.
All right, so now that we've spoken about all that stuff, I kind of wanted to get into the last thing, which is called the coverage gap. So basically, a coverage gap is a period in time where your insurance is not going to want to pay the full price that they've been paying for the normal portion of your period. So think of in the term period. So say it's a full year and it starts in January. So say you typically pay $100 a month for all your medications that you pay for in copays. So for the first couple months of the year, you'll be paying $100. And then if you go into a coverage gap, that'll be a moment where you'll have to pay higher amounts because the insurance is going to want to pay as much. So let's say that you enter your coverage gap in March. So you go 2 months without paying the $100, and then you'll enter the coverage gap in March, and say you're there for 6 months. So for those 6 months, you will be expected to pay like $150. Your price will go up like a certain amount. It won't be too much, but it'll be a noticeable amount, and you'll notice that you're definitely paying higher on your medications. But then once you exit that coverage gap after the few months that you're in it, your prices will go down from the original price. So you'll be paying a price lower than the $100, maybe something like $50 or $75 a month. So basically, it's a period where you pay more money, and then once that period ends, you pay less money than you originally did. Does that make sense, how you go in and come out of the coverage gap?
Yeah, so that explains why my copays always fluctuate.
Yeah, so that's why copays typically fluctuate, and patients can come into the pharmacy, and typically if they see a copay fluctuate, they'll say, oh no, but I paid $20 last month, why am I paying $40 this month? And that's all just with things like the coverage gap. So typically your copays could fluctuate, but you should expect, if you are paying a higher price for a little bit, you should definitely expect for that price to come down after you do exit the coverage gap.
Okay, perfect, thank you.
And now that we've pretty much covered everything, I'm pretty much just going to go through some questions to make sure that you got all of the information from today and that it can help you moving forward. So can you explain to me the difference between a premium and a deductible?
So a premium is decided by my insurance company, and it's a fixed amount that I have to pay every month, regardless of whether I'm going to the doctor or not. And that premium can go up or down depending on if I stay with my insurance company or if I go to a different one. And the deductible is a fixed amount that my insurance company pays, and then once I get to that money, I have to start paying copays. Copay is like a fixed amount where every time I go to the doctor, I have to pay that amount to be able to see them.
Perfect. And then I'm pretty sure you understood the formulary and the tiering and how it separates them into different tiers based on their prices and things like that, so you can get a good idea of how you're gonna be paying for your medications and how much it's gonna charge.
Yeah, there's the 4 tiers, like tier 1, tier 2, tier 3, tier 4.
And it'll usually increase in price as you go up in tier. And then we went over the star rating, and that's basically just an overall outlook of what this insurance is giving you. Basically, how good is this? If it's a 5-star, you know that it probably is giving you a lot of things, and there's not a lot of things that it doesn't cover. And then you remember we spoke about brand versus generic drugs. Do you want to give me some input on brand versus generic drugs?
Yeah, so right now I'm taking Crestor, which is the brand version of rosuvastatin calcium. So Crestor is more expensive, even though a brand and generic are pretty much the same thing, except for differences in like color and pharmaceutical ingredients. So basically I want to talk to my doctor to be able to get rosuvastatin calcium instead of having to pay more for Crestor.
Perfect. And then would you be able to just outline the basics of a coverage gap for me?
Yes, so certain months of a year I'm going to be having to pay more for my copay, and then after that coverage gap ends, certain months I'll be paying less.
Yep, perfect. That's exactly right. So if you don't have any other questions,
no, I'm all right.
All right. So I guess we're all set then. If you have any further questions, or if anything pops up or any concerns, you can feel free to call us at the pharmacy or step in.
Thank you very much.
All right. Have a good one.